Hello, my name is Sharrie Harlin. I am the Community Outreach Coordinator for Reid Health, and welcome to Reid Beside You. Reid Beside You is an extension of Reid Community Outreach, and today we have as our guest Beth Overmyer and Kathy Roberts from ClaimAid, the eligibility company that works with Reid Health. And our second part of the show, we will have Tajaun Stoker, Director of Wellness at Reid Health. And first, I'd like to introduce Beth and Kathy.
Thank you for having us.
Thank you, Sharrie.
Well, welcome to Reid Beside You. And let me ask Beth, what is ClaimAid?
Sharrie, ClaimAid is a private company that works with medical providers all over the state and other states as well. And we assist individuals with application for health coverage. Here at Reid Health, we help the uninsured and underinsured with applications for health coverage.
Okay, great. And actually, I'd like to ask both of you, and how long have you both been with ClaimAid? First, I'll start with Beth.
I've been with ClaimAid since 1989. And I've worked with healthcare facilities and patients all over the state. Prior to coming to ClaimAid, I worked for the Indiana Family Social Service Administration, where I was an administrative law judge. And currently, I'm executive vice president, and my primary responsibilities include research, policy, education, and working directly with healthcare, our healthcare facilities.
Great. And Kathy?
Thank you, Sharrie. I've been with ClaimAid for over 26 years. I joined in 1990, and my background, like Beth's, is with family and social services. I have a social work degree, and prior to coming to ClaimAid, I worked with family and social services as a Medicaid supervisor, supervising all of the various Medicaid programs that the state of Indiana currently offers. My role now at ClaimAid is Vice President of Eligibility, and I currently manage all of the Reid advocates here at Reid Health.
Okay, great. And Beth, does ClaimAid work with other organizations in the Reid service area?
Sharrie, we certainly do. We work with many organizations all over the surrounding area. We want to make sure, as Reid Health does, that any individual that might need some assistance is able to get that assistance to help with applications. So it is very important to us that anyone who is in need receive that service.
Okay. And you were saying that the ClaimAid advocates help the uninsured and underinsured with many health care coverage plans available through the state as well as the federal government. What are those plans?
Those plans in both Indiana and Ohio can include programs that cover infants, children, pregnant women, adults, those that have that are age, blind, disabled, those that are on Medicare, Medicare beneficiary. There's programs for that's called Medicare Savings Plans, as well as Social Security applications and supplemental security, which is called SSI. And also the marketplace through the Affordable Care Act.
Great. And Kathy, what's the application process? Well, a typical application process,
Well,
rather.
typically a patient, or doesn't even have to be a patient at Reid Health. It could be just anyone in the community who's interested in learning about what benefits might be available to them. We would meet with them, screen them for all of the various programs that the state offers, and then help them through the application process. In Indiana, all of the applications are done online, so we would have the patient sign consents, allowing us to work with them, become their authorized representative, and then get that application filed for them. Once the application is filed, the local governing agencies, such as Family and Social Services, have the responsibility to process it and determine the actual eligibility. We're on the back end part of it, helping the patient or individual secure any of the necessary documents, whether it's a birth certificate, photo ID, income verifications, bank statements, whatever is required for the specific program that they're applying for, we will help them secure those documents and get them submitted in a timely manner. The state has very strict guidelines that are set by the federal government that they must adhere to, and we want to assist the individual in getting the documents turned in a timely fashion.
And I know I work very closely with your ClaimAid advocates and the community, and often as we're trying to secure the information, people might be hesitant. So what you're saying is that your ClaimAid team can assist them getting the information. I find a lot of times people say, I don't have an ID,
Right.
and how can I get that? Or I don't have my birth certificate.
Absolutely. Anything that we can possibly do to assist, we will do. We've secured birth certificates for individuals who live out of state and don't know even how to go about getting it, or know that they can't pay the necessary fee. We'll be happy to assist them with that. Individuals sometimes will say, they're asking for my check stubs. I don't keep my check stubs, or it's all online and they're not able to process that. We have a form, we'll have them sign giving us consent, and we'll fax it to the employer. We'll work with the employer to try to gather those documents and whatever information they might need.
Okay. And often, I also understand that there's been people that have applied, might have not been approved, or circumstances have changed, or they might have had to have an appeal.
Absolutely.
So can you explain, how does the appeal process work?
Appeals are very set in stone. You have to file your appeal in writing, and it must be done within a specific time frame. So we will assist the patient with that. Every individual always has the right to representation of choice. So we will offer our service to them, keeping in mind that all of our services are at no cost to the individual, and explain to them the process that is going to occur with an appeal. And if they choose to say, I'd rather do it on my own, that's fine, but we want them to know that we are available to assist. We will go to the appeal hearing with them, and we'll help them secure any necessary documents that they might need.
And that is all free, correct?
Absolutely.
That is part of the process.
Absolutely. There is no, ClaimAid does not charge the individual or the patient any amount of money whatsoever. The service is provided to them as a service of Reid Health.
And that's very helpful. And we want the community to understand that. And we have worked, how many years with, we've worked for years with ClaimAid.
It's been over 18 years that we've had a partnership with Reid Health, and we're proud to work with the administration as well as the patients in the community, because this service is available to anyone regardless of where they're receiving their medical care.
And the good news is we have a lot of longevity that a lot of the advocates have worked for years. We are now finding people that we're the second generation of people that they've been able to assist for ClaimAid.
Yes.
And the other thing is, we as a hospital system want to make sure that everyone in our community that can has access to care.
Absolutely.
So that's why we partner with ClaimAid, just to make sure that anybody who is eligible after being screened has an opportunity to have health care. So we love our partnership. It's been very easy to work with you.
We love it.
So another question is, how long does an applicant have to wait before they're approved?
Sharrie, every program has a different deadline and processing timeframes, and those are all based on federal law. This is why we believe it is very important and encourage anyone who's working with a ClaimAid advocate to stay close in touch so they can guide them through the process, as well as making sure that it is done in a timely manner. And one more thing I want to add is that the programs and the income guidelines, they change every year. So there are individuals that had no idea that they were eligible for coverage and find that they are now because the guidelines have changed. So if someone had been denied previously, we encourage them to contact us because it could be that every year that the income guidelines do change.
Another thing I wanted to explain to the community, I think there was a lot of misinformation that the original HIP had a limit for the entire state.
Yes.
And the HIP 2.0, there is no limit of how many people can register, correct?
That is correct.
Okay.
That is correct.
So along with what Beth was sharing with us, that people that might not have been eligible previously, they are eligible now. And
Yes.
we want to make sure. So for instance, you might have had a change in employment or a change of household size, so that those people would be eligible as well. Another thing is we do offer we have some assistance with power accounts. And could we explain a little on the power account?
Definitely. In order to receive the best benefit, if you're eligible for the Healthy Indiana plan, one would make a payment to their power account. And this will provide dental and vision coverage as well. And no cost sharing, so there's no out-of-pocket for your pharmacy as long as it's approved, an approved medication. So here at Reid Health, they're offering some assistance to be able to help with that power account.
And through that, we partner with the trustee's office
Yes.
in the various townships.
Yes.
So and that's a very big benefit.
Definitely.
Because the
definitely.
difference is, if your power account is paid, then you stay in HIP Plus, which means you don't have co-payments.
Yes.
And if you haven't made your power account and you're over the poverty limit, then you would have a copay.
Yes,
Correct.
and you could be locked out if you don't make your contribution. If your income's between 100 and 138% of the federal poverty level, so if you're at the upper end of eligibility for the Healthy Indiana plan, and you fail to make your contribution, then you can be locked out for 6 months. So it's very important to know and understand your obligation, and to be able to make that payment. If you have difficulty, to be able to go to the township trustee and ask for some assistance for that.
And that's new, correct? To some people that may have had traditional Medicaid weren't familiar with like a redetermination or a paying on their power account. And that's why we need people to work with your ClaimAid advocates so
Yes.
they can explain that information to
Yes.
them.
And anyone who's on HIP will have an annual redetermination.
Okay.
So they will receive written notices telling them that it's time to just re-verify their situation. And a lot of times, individuals might miss that mailing, or they've moved and they didn't get it, and they lose their coverage. They need to contact a ClaimAid advocate, and we'll be happy to help them reapply and hopefully get those benefits reinstated. And because of our great partnership here at Reid Health, we do have 5 advocates who are available to assist throughout Monday through Friday, and they're located at different areas in the community to help the community. We have an advocate who's located at the business office downtown at 600 Main Street. We have an advocate who has just moved to the new Reid Urgent Care building at 1501 Chester. We have an advocate who's located in the Reid Emergency Department, and she will see patients as they come in through emergency. And then we also have 2 other advocates internally in the hospital who are available to see walk-ins through the hospital, inpatients, outpatients. So we want to touch as many lives as we possibly can.
And you do.
Thank you. That's our goal.
We want to thank you for, one, providing the service, the eligibility services at Reid Health. And we have a great partnership. And we want to thank you for coming to Reid Beside You.
Thank you. It's been our pleasure.
Yes,
Thank
for the
you very
opportunity.
much.
Thank you.
Thank you.
We want to welcome back our viewers. And our next guest is Tajaun Stoker, who's Director of Wellness at Reid Health. And Tajaun, welcome.
Thank you. Very happy to be here.
And can you tell me what the Wellness Department does at Reid Health?
Well, we do a number of things. Our goal is to definitely make sure that the lifestyles of our employees and also for the public as well is one that they involve health and wellness activities in it. Things like exercise, healthy eating, and overall stress-free living, if we can say stress-free,
Okay.
Stress reduction. So that's our goal at Reid Health for our employees and also for the public too. We do a number of things like health coaching. We do some community programs as well, some diabetes screenings, cholesterol screenings, health fairs, and so on and so on.
And when you say you work in the community, how's that take place?
Well, a lot of times we work with you, Sharrie.
Yes.
So, like for example, we do different presentations in the community, different free presentations. As I mentioned, some glucose screenings for free in the community. We'll help out any way that we can and actually provide health and wellness information out there that we can. But again, it's those type of presentation and actually increasing the knowledge for the public on an ongoing basis.
And I wanted to ask you some questions about one of the larger community efforts we have, Reid Healthier.
Yep, Reid Healthier.
.org.
Yep.
So can you share with us about that program?
I definitely can. Reid Healthier is kind of a spinoff of our employee wellness program. For our employees, we have a wellness portal where they can go online and actually go to one site and learn about all the different wellness offering and wellness initiatives that we have for our employees. For the public, they can do the same thing. It's a little less complicated, I would say, for the employees and a little less things under for the for the public. But the thing is, we want to engage the public in a different way. And by going to reidhealthier.org, those individuals, they can basically go on and create a profile where they can participate in things like online challenges, walking challenges. They can get incentives for participating in this program. And as we say, it is a wellness club because we have certain things that we're going to do with them, with the public, those individuals who sign up on reidhealthier.org later on in the future. And just for signing up, those individuals will get a welcome kit as well.
Oh, and looks like you brought us an example of the kit. Can you show us what you would receive?
So individuals, they'll get a water bottle. So they get a water bottle just for signing up. And also they get this fitness journal. That way they can track their daily activities or weekly activities and monthly activities. And they all come in this little bag here. And that's provided by our community benefit department. So we've partnered with our community benefit department to actually offer the Reid Healthier program to the public.
And have you had how's your response been currently?
Response has been very well. Right now we currently have right around 500 of the community members that are actually participating in this. Our hope is to continue to grow it as we continue to offer more programs on an ongoing basis. We're looking to expand it beyond the Wayne County area, so we're working on some campaigns right now to actually get that within our service area.
And so currently, is this just limited to Wayne County?
Right at this moment, I would say, but we're working on those plans to actually get it out there a little bit further. Working with our marketing department, and they're going to start putting some information out there, or probably already have started putting information out there.
Okay, so if, as an individual, I wanted to contact your department, what would I need to do?
Basically, they can call us at 765-983-3215, or they can just go to reidhealthier.org and actually sign up for it. But calling us, we can walk you through all the different steps of actually signing up for the website and answer any other kind of questions about ongoing activities or ongoing events that will be going on throughout the year through 2017.
Okay. One of the questions we hear often, wonder if someone wants to sign up, but they don't have access to a computer.
Well, one thing that we realize is that a number of people actually have smartphones. So if you have a smartphone, You can actually access it through a smartphone too. So don't let not having a computer at home stop you from signing up for this program, because it is a very good program. They can also go to the library if they want to, go to a friend's house. However they want to do it, they can sign up for this program. But one of the things they do have to do is go on to the site on an ongoing basis to say that they've actually participated in different activities. And that way they'll earn points toward incentives. Incentives like, cooling towels, dumbbells, and so on and so on.
I know there's a big trend of people that use fitness trackers. Is that a necessity to participate?
It's not a necessary necessity, but we do some programs, some wellness challenges on the portal that are associated with the fitness tracker, like a Fitbit, like what I have on here.
Okay.
And most individuals, or a lot of individuals, now have these fitness trackers. It doesn't have to be very expensive. It has to be ones that a Fitbit or a Garmin. The one that we actually utilize on the site. So if they have a Fitbit or a Garmin, you can sync it to the site, and individuals can start utilizing some of the different challenges that are on there once we announce different challenges.
And if I'm an individual who's been pretty sedentary, and I see this our show, what might be some of the first steps that you would ask a person to do?
Well, number one, I would say first, if you're not doing a whole lot of activity, number one, please go see your doctor. Start out there. Start out with your doctor and ask them what type of things you should be doing. We want to make sure that you don't have any kind of existing conditions. And if you do have existing conditions, your physician can actually walk you through the phases of starting an exercise program, a nutrition program, and so on. After that, if you want to get started with some physical activity, start out with just a small walking. If you're not doing anything at all, nothing that's too strenuous, but brisk walking, just to get your heart rate up just a little bit, but you don't want to overdo it. You just want to test it to see where you're at. But number one thing is to start out with your physician first.
Okay. Then another thing is, often we see so much about various trend diets. And so a person might say, well, I'm starting this trendy diet and I'm going to walk 4 miles a day. And they do it, they attempt to do it maybe the first day, and then they stop.
Right.
Well,
what I would tell a person that's going on and off diets, certain eating regimens and diet nutritional regimens, I would say, don't do a lot of fad dieting. That's not what it's about. It's about creating a lifestyle change and lasting lifestyle change over periods of time. If you're looking for a quick fix, good health and wellness regimens are not about quick fixes. If they need some type of nutritional advice, they can definitely follow up with our diabetes nutrition department at Reid Health, or they can contact us again at 765-983-3215, and we'll definitely point them in the right direction.
Oh, great. And you've mentioned several of the other Reid departments. So we often hear, when we hear wellness or we hear Reid Health, people think of an emergency or a major medical catastrophe without including just overall wellness.
Wellness, right.
So what would be?
I would say with our mission statement, body, mind, and spirit, wellness is basically right in the middle of that. And that's what we believe at Reid Health. And that's basically why part of the name change as well, because we want to focus on the health of an individual, not just the emergency part, not just when you're sick, not when you just, you're feeling bad. We want to take care of you and make sure that you stay around for a long period of time. So that's why we focus on wellness for our employees, and also that's why we focus on wellness for the community.
And I didn't want to negate that you have a team of wellness people.
Definitely do.
Can you share about your team?
Yeah, we have a team of health coaches. We have 5 individuals right now. We have a tobacco cessation person on our team. We have a massage therapist that's on our team, and so on and so on. So we've invested fully in wellness for our employees and for the community.
Okay. And also, before we finish, I wanted to ask, how did you get into wellness?
Well, me, I have a personal desire to see other individuals live a healthy life. I think that's one of the things that we definitely can do to prevent early death. is by being well and definitely paying attention to some of our health history overall, and doing some of the simple things, walking, eating healthy, and just paying attention to things that we should be doing on an ongoing basis, and staying away from those things like fried foods, and staying away from things like lack of exercise and just sitting on the couch and not doing much. It's simple and it's easy for a person to get up and get around if they're capable of doing that. So like I said in the beginning, I believe in individuals starting out with a physician and looking at wellness, health and wellness as a privilege as well. So that's kind of how I got into it. But also, by being an athlete growing up, it was one of those things that stayed with me, is staying in shape and being active.
Okay. And we are very aware within the Reid community that when we see Tajaun and his team, there's been times that I know that we've been in the cafeteria and we see your team come and you'll think again before you reach for that extra dessert or
that donut,
or
right?
the donut. So it's just the message that is sent through not only the community but also internally at Reid.
Yeah, and our goal is not to scare people or intimidate people. We want to be friendly with everybody and want everybody to understand that we're here to help them out.
So wellness is our friend.
Wellness is your friend.
Oh, great.
Yeah.
Well, we'd like to thank Tajaun
Thank you.
for coming to share with the community today.
Thank you.
And thank you very much. And that concludes our show for today. And we'd like to invite you to tune in next month for Reid Beside You.